California Edition. I'm Brad Pomerance. We're coming to you from Sacramento, California, our state's capital. We are joined by Ed Hernandez. He is a member of the California State Senate. He chairs its Health Committee. And as a result, sir, I'd like to speak with you about the Affordable Care Act covered California. We've been speaking about it for several months. But since the last time we spoke, we have some hard numbers on the first 3 months of covered California's existence, October, November, December. It's hard to deny that the statistics are pretty positive. I mean, about 500,000 Californians signed up for Covered California. Yes. And while Covered California didn't have a perfect rollout, obviously it was better than healthcare.gov. What's your take on the first 3 months of Covered California?
Well, if you look at the first 3 months, obviously much better than the federal government.
Sure.
The newest numbers are even better than that. But I want to put things into perspective.
Please, please.
This is the absolute biggest thing that's happened in the country. So things aren't going to be perfect. There's going to be some glitches. And with all the negative press around, repealing it and, the Republicans wanting to stop it, California has taken a lead and we are huge numbers. Besides the 500,000 of individuals that are enrolled in small group, almost over 1 million people for Medi-Cal. That's a 1.5 million.
Which is
total.
So stunning on so many levels because, as you know, the U.S. Supreme Court ruled that states are not required to accept the Medi-Cal expansion, the Medicaid expansion. And about 25 states or so did not accept it. Some of them are ruining that day because it really is providing healthcare access to some of their poorest communities, and as I understand it, some Republican governors are starting to have second thoughts.
Right.
Maybe we should have accepted this expansion. Interestingly, it was our prior governor, a Republican, Arnold Schwarzenegger, who went on record immediately accepting the expansion.
Right.
That being said, do you feel as if the numbers are as strong as they should be?
Nothing this big is ever going to be as strong as it should be. And I think one of the things that I still have a concern with is the number of Latinos that have been signed up or that are going to sign up. For this to be successful, and in order for us to lead the way in the country, we have to make sure that the Latino population continues to grow. It's getting better,
right.
But it needs to continue to grow.
I'm a little more pessimistic. I look at the statistics. I mean, I hope it will grow for the community's sake. But wow, I throw some numbers at you. Half of all the uninsured in California are Latino.
Right.
28% of Californians are Spanish speakers. That's different than Latino, but Spanish speakers. Yet the early numbers suggest just over 5% of those that have enrolled in Covered California are Spanish speakers.
Right. And that's a concern to me as well. Yes.
I think that's a huge concern.
Yeah.
What's gone wrong?
Well, I think what's gone wrong is the marketing is there. But I think the marketing may have missed the point in the sense that they market television, media, radio, and they encourage them to go online, and maybe not all Spanish speaker patients have access to internet.
Well, we know that's true. I mean, the digital divide is very significant.
So in order for us to be successful, we have to put emphasis not necessarily in marketing, but in enrollment and getting boots on the ground and people out there to enroll these individuals.
But what we know is that English speakers, Spanish speakers, whatever it may be, there are not enough navigators,
yes.
Those boots on the ground. And that has been a sore spot for Covered California.
Right.
So what can be done?
Well, I mean, we have to do as much as we can between now and March and continue to work to get more individuals and maybe rethink how the dollars are going to be used to incentivize individuals to go into the communities to sign these individuals up and work in collaboration or partnerships with labor, with nonprofits, with hospitals, with clinics, etc.
For our viewers on HLN, I want to thank you so much for joining us. For our other viewers, we'll be right back with Senator Ed Hernandez. So, Senator, let's continue our conversation, if we may.
Sure. And
you talk about the redirection of funds as it relates to marketing to Latinos. I do want to talk a little bit more about the unique flavor of the Latino community. One of the most beautiful things about the Latino community that I have noticed is the familial unit and how strong it is.
Right.
Lots of matriarchs, lots of patriarchs. Oftentimes the matriarchs and patriarchs were not American born, came from countries with oppressive governments, and are fearful of any type of government program. And as I have been told, that is part of the issue, is that the matriarchs, the patriarchs, are just, they just don't want to get involved. and so it kind of trickles through that familial unit. Is that fair?
Yeah, it's fair. However, I believe that those same individuals who may have pause with government want the service.
Sure.
They need it, and they understand that. But I think the divide now is to educate them in their foreign language, get somebody from their community, their church, Norma Torres, their friends, to talk to them, to get them to sign up, and they will sign up. I'm convinced they'll sign up because they're looking for the service and they need it.
Now, I know that you have had some town halls in your community. Were those town halls attended by English speakers, Spanish speakers, Asian language speakers? Who was coming?
The Spanish speakers.
They were.
And here's the reason why, is I represent a predominantly Latino community, and for example, the city of Azusa, we held one at the school board meeting right shortly after that, and they put it together, packed house.
Really?
Packed house, and we, mainly Spanish. I did a presentation in Spanish as well.
Right.
And the Spanish speakers who were newly immigrated here, they were asking the questions. How do I sign up? What is the cost? My husband is employed. I'm not. Can I get? So they were asking the right questions because they are interested in it. So that's why I'm convinced that once the message is done, and once somebody can help them navigate to enroll, they'll enroll.
At this stage, though, for those individuals that are not documented, they're not eligible for the Affordable Care Act. As I understand it, though, one of your colleagues, Ricardo Lara, is looking at changing that in California. I don't know much about his bill, but I'm wondering, is that something that a state can do under the Affordable Care Act?
They can, but I haven't seen the details either, and I haven't seen the language, but I'm supportive in general. And here's the reason why, because I believe everyone should have access to health care. And in order to do that, it's going to require dollars. Obviously, the federal government's not going to supplement. If we're going to do it in California, we either have to do it through the Medicaid system, or it's going to have to come through the general fund, where I think that could potentially create a problem, because there's limited resources. The budgets are increasing, yes, there's surpluses, but will the legislature, do they have a stomach to be able to put money in for the undocumented?
But what's also interesting is the children of undocumented, even if the child is undocumented, as I understand it, sir, is eligible under the Affordable Care Act.
Yes, through Medicaid.
So there are a lot of complicating factors, and it's critical, as you say, to get the message out so that folks understand. I want to ask you also about Medi-Cal reimbursement. You yourself are a doctor of optometry. Are you eligible? Do you access Medi-Cal through your office?
Yes. When I see patients, or when our offices see patients, I say 30 to 40% of our patient base is Medi-Cal.
And so you know that California at this stage has the lowest reimbursement rate in the union.
Yes.
Lower than our friends in the South, in the Rust Belt, 50 out of 50. Is that going to change?
I hope it does. But here's the interesting thing is, yes, California hasn't kept up with inflation since the 60s. We have the worst reimbursement rates. But there's some data out there that shows even with higher reimbursement rates, you're not necessarily going to get more providers in.
Really?
And I think it comes down to one simple basic concept. Providers that go to these particular communities, they choose to because that's kind of how they're built. For example, why is it that teachers gravitate towards poor communities? Why is it that people go into business? Now, to solve that problem, by increasing the reimbursement rate, yes, we should. We need to do that. We also need to encourage individuals who are providers in medical school, optometry school, dental school, but more importantly, start even sooner and get people who think that way into those programs to go back to those communities. That's how we solve that problem.
So is that something that can be done legislatively, regulatory-wise, charitable-wise?
I mean, there's a lot of ways around doing it. Number one is we need to look at how we accept kids into these various programs. The admissions process needs to be looking at gearing towards the kid that's minded to go to the community of color.
His name is Ed Hernandez. When we come back, we'll speak with Norma Torres, also a member of the California State Senate. I'm Brad Pomerance. It's California Edition.
In the first 3 months of affordable care, running from October through December 2013, California had the most exchange enrollees in the nation. Which state came in second? Florida, Massachusetts, New York, or Pennsylvania? Florida edged out New York for the second highest number of exchange enrollees in the country in 2013.
California Edition coming to you from the state capital, Sacramento, California. I'm Brad Pomerance. We are joined by Norma Torres. She is a member of the California State Senate, has been for about 6, 7, 8 months. How do you like your new job? You came from the Assembly, now you're in the Senate.
I love my new job, and
Okay.
thank you for inviting me today, Brad.
What are the differences between the Assembly and the Senate to you?
About 40 less members.
Right. State it simply.
It absolutely is the grown-up house. I think we are so much more collegial. I find relationships among both, parties are very, very good relationships.
That's good to hear. Very good to hear. It's funny to think that Sacramento is considered functional compared to Washington, D.C., which just seems to be so dysfunctional. I want to speak with you about healthcare reform. Some would argue it's functional, some would argue it's dysfunctional. In California, it does appear that Covered California, or healthcare exchange, is functioning fairly well. About 500,000 people signed up in the first 3 months, the best numbers of throughout the nation, even though we have a large population. What's your sense of the early returns on Covered California?
Well, I think the early returns tell the story of what California residents need, and that's healthcare. It is a good product. Covered California really needs to be congratulated on the product that they have put out, the programs that they have created. I think sell themselves. We don't need a marketing plan on that. Where I have been critical is on the customer service part of it.
And I do want to mention, from government customer service because you, in your prior life, you were an administrator in a 911 call center, is that right?
I was a 911 dispatcher.
Literally, yourself?
Yes, absolutely.
Oh, so you know exactly how to take a multitude of calls coming at you on very challenging subjects, like healthcare, I guess one could argue.
Absolutely,
Right.
And the importance of that customer experience. Imagine on the 911 line if we did not answer those calls. And that's something that I have taken on over the years, too.
Can I ask you, were you taking calls in English or Spanish?
Both.
So I want to ask you about the Spanish side, because what we have heard is that Covered California may have fallen down on customer service for Spanish speakers. I'm not sure if yet, but I do know for a time the paper application was not in Spanish, which is surprising given that the digital divide impacts Spanish speakers more than English speakers. So you would have thought that would be the first application that would be printed.
We have been bringing this issue to the attention of Covered California since November, right? And I was very disappointed at the fact that not only did they not have a Spanish application, that the website Spanish links were broken.
They had been.
And there was no hotline, no telephone number in Spanish.
Has that changed?
Somewhat. There are some links on the website that do work, but not all of them. So, for example, if you go onto the website and you are a Spanish speaker and you want to compare the plans, you just want to get an idea of what it would cost to get health care. You click on that link and it takes you right back to the English side. If you're a happy customer, let's say you went through the entire process and you have health insurance and you want to share that with your family member. And we know that in order for us to reach this hard to reach community, they deal with that circle of trust, right? That inner circle of trust. So you click on that link to refer your friend. The link doesn't work. It takes you right back to the English site. Very little minor issues that could be fixed because they create a bigger problem.
Let's talk more about it when we come back. For our viewers on HLN, I want to thank you so much for joining us with Senator Norma Torres. For our other viewers, we'll be right back. So you've mentioned, Senator, that there are these broken links. We also know that California had intended to have literally a cadre of navigators. I think it was 6,000 that would help those navigate through Covered California, and obviously we needed a good number in Spanish, Spanish dominant. We're not even at 3,000, and the numbers for Spanish speakers is even lower.
10%, which is dismal.
And think about this, I don't mean to throw stats at you, but I have a few in my mind. 28% of California, Spanish dominant, and half of those that are uninsured, Latinos. We don't know if they're Spanish dominant, but Latinos. And so you would think the customer, the targeted customer, would be those Latino/Spanish dominant speakers.
So we know the two pillars, right? The two pillars that we need in order for Covered California to be successful, not for the short time, but for the long haul, right? We need to have healthy individuals, and we need the Latino community. Very, very hard to reach.
Healthy young Latinos.
Healthy young Latinos.
That's what we really need.
Yes. So one place where we can help enroll in these hard to reach folks is through the website. They're techie, they may not have a computer at home, but guess what? They're all on social media. They all have a cell phone. Why not utilize all of those resources available? My gosh, at the very least, put a phone number and get a counselor and allow them to get through the telephone line.
Have you had a chance to speak with Covered California? I mean, you have these solutions. Has Peter Lee, the executive director, taken your call? You are only one of 40 senators. I mean, there aren't many.
To their credit, I do want to say, myself, as part of the Latino caucus,
Senator Hernandez.
Yes, we have met with Peter Lee. To his credit, he has assured us that he will continue communicating with the Latino caucus, with my office, to ensure that all of these issues are addressed. From my point of view, they're being addressed. They're being heard, but not necessarily being addressed, and they're not being addressed at the urgency that they need to be.
I want to talk to you more about that circle of trust, because it's undeniable that one of the beautiful things about the Latino community is the familial unit. I mean, strong families. There's often fear within that familial unit of government.
Absolutely.
Many of those familial members may not be American born, may have come from countries where there was a lot of fear of government. And so if one or two members are afraid, it can be part of that whole circle of trust. How are you trying to convince these familial units that it's okay, that no one's going to deport you because you sign up for Covered California?
Yes. I think that is such an important point, which leads me right back to that link on that website for those that have already signed up. You know, and we know that, you know, a few thousand have already signed up. So why not utilize them as a tool to help them promote the Covered California and get their family members and their friends?
Have you had town halls?
Yes,
we have
had town halls.
Tell me, what are they saying? What are you hearing, especially from your Spanish dominant speakers?
Yes. So 1 in 4 residents of the Inland Empire does not have health insurance. That's why I am so vocal and outspoken about getting it right, because my constituents need it, my constituents want it. What I am hearing from constituents is that, number one, they go to the website and the website crashes. They are spending hours and hours.
Sounds like healthcare.gov. I mean, and we're not hearing these stories.
No, we're not.
Which is pretty surprising. You would have thought, but look, the English media and the Spanish media often, they don't mix, so we wouldn't know. Well, is the Spanish media, Univision, Telemundo, are they covering the problems with the Spanish website?
They are, but we need to be clear about 2 things. One is that we have an awareness campaign. That was last year.
Right.
People don't need to be made aware that Covered California, that Affordable Health Care Act is the law. They already know that. Right now, our campaign is to enroll people. Not necessarily just the class that is coming to us that we know are seniors and very sick folks, right?
We need the young, healthy.
We also need the young, so we need to balance the two. That's why the customer service experience has to be improved.
Will it be? Is it going to be? Has it been?
I have faith that it will be. I think that we're going to get it right, but we need to make some drastic changes, and that's why we are introducing a couple of bills to reform the Affordable Care Act.
And you'll have to come back and tell us about it because we are out of time. Her name is Senator Norma Torres. My name is Brad Pomerance. You are watching California Edition.
What percentage of enrollees in Covered California have been deemed eligible for a subsidy under the Affordable Care Act? 50, 65, 77, or 85%? About 85% of people signing up for coverage through Covered California are eligible for a government subsidy that lowers premium costs.
Welcome to Charter California Edition. My name is Brad Pomerance. You know him well. His name is Sam Blakeslee. He served in the California State Assembly and the California State Senate from 2004 to 2012, 6 years in the Assembly, about 3 years in the Senate. He is now the founding director of the Institute for Advanced Technology and Public Policy at Cal Poly San Luis Obispo. Congratulations, Mr. Founding Director.
Well, thank you. It's great to be here. Good to see you again.
You bet. Tell us about the Institute.
Well, you know, I left the legislature almost exactly 1 year ago.
Right.
And it gave me an
Of your own
opportunity-
volition, by the way.
That's correct.
Of your
I
own
elected
volition.
to not
Yes.
run in that race.
Right.
And decided to instead invest my time in this proposition that we need better ideas for public policy. And that most of the bills we voted on routinely were really poorly crafted in Sacramento.
And voted on with
Sometimes
no,
in the dead of night, with very little
with no
analysis.
vetting.
A lot of bills were, in fact, written by special interests that were fighting against each other. And what I found frustrating.
And if I may interrupt, you were in the room, especially in 2009, 2010,
Yes.
because you were minority leader of the Assembly. So you really had a bird's eye view. I mean, it was the big four back then. It was minority, majority, and then the governor.
Well, you bring up a really good point.
Right.
You know, I started as a backbencher.
Right.
And worked through the system, effectively moving to the top of the respective org chart.
Right.
In an effort to try and drive change and create real reform and make Sacramento work. And notwithstanding every effort I made,
Yes.
I continually found myself working in a highly dysfunctional system. In large part because even at those critical moments where people were willing to compromise,
Right.
the hard work to create good policies around which you could say yes to had not happened. And so time and again you saw these grand compromises come forward, and then they would say yes to really shoddy product, to bills and initiatives and proposals that were not well vetted, and solutions which, even if the voters were to implement them, would not have worked.
And it was such a tough time back then. I mean, 2009, 2010, it was just ground zero of the economic meltdown. And so
Yes.
the choices were far and few between.
There were no good
yeah,
answers or
exactly.
no pain-free answers. There was no, well, let's just start universal health care.
Right,
let's just
exactly.
Start universal
Right,
daycare.
pre-K
Let's just spend another
right.
$10 billion on our favorite
Right.
whatever project. It was, where do you make the tough cuts? And how do you radically restructure government so it actually works and performs?
So
the notion is that with this institute,
Yeah, please.
we want to create those ideas so that when those moments of opportunity present themselves, there are really strong, thoughtful, viable policy solutions that could actually be implemented and would work.
So the title of the institute is Institute for Advanced Technology and Public Policy. You're saying something with that
Advanced
title.
technology and public policy speaks to this, I think, very fundamental fact that we're operating in a world that's changing very rapidly.
Oh my.
You can look abroad, you look at overseas, you look at the phone in your pocket. Everything is changing. The last place where change is admitted is in government.
This is an anecdote, and I must say it to you. So all my segments, all our segments, we get YouTube links.
Yeah.
I send them off to the staffs of the various members. I put them on my Twitter feed, my Facebook. Maybe 1 or 2% get retweeted or shared on Facebook. I don't mind that, but I would think the members would want the free press.
There's
And-
enormous inertia.
Right.
And people are naturally very resistant to new ideas and new ways of doing things. That's true for something as simple as tweeting
Right.
a link, but it's doubly true for how do you make government smarter and faster and more efficient. If you think that's true for one person, imagine a body of 120 people and state agencies
And then
that are highly
we
resistant
think
to
about
change.
technology and how healthcare.gov didn't go so well.
A classic example.
Yes, how
of-
Covered California went better, but has had its challenges.
That's right.
How the Oregon healthcare website never has gone up. And so when we come back, sir, I want to continue our conversation, hear more
Terrific.
about some of your ideas. We're speaking with Sam Blakeslee. He is now the founding director of the Institute for Advanced Technology and Public Policy. For our viewers on HLN, thank you for joining us. For our other viewers, we'll be right back. So, sir, I'm sure you have some very specific ideas about what you'd like to do to marry technology and public policy. Begin.
I will. First, I'd like to point out that the Institute is strictly nonpartisan.
Okay.
And that's important because although I am a Republican
Yes.
and a proud Republican,
Right.
I leave my party registration at the door when
But
I
what's
face public policy questions.
What's interesting about you, if I may say, is you are a Republican and you were the minority leader in the Assembly, but you have been attacked on both sides for being a crazy conservative Republican and a rhino, a Republican in name only. So maybe that's a good thing. Maybe that says a lot about you and that you get attacked from both sides.
I don't know if it says something about me or it
Right.
says something about the political environment in which we're operating. My background is as a research scientist, so I take a very, I think, real-world, pragmatic, how do you solve problem approach as opposed to a strictly ideological approach when I engage public policy.
But I do think that having been attacked by both sides probably gives you a bit of credibility when you say this is nonpartisan.
It is nonpartisan. I would agree. And one of the things I've done to try and demonstrate that it's nonpartisan is the board we've pulled together is strictly nonpartisan. So we have people like Charles Munger, who's a very active Republican, who supported and actually helped pass the redistricting reforms and the nonpartisan primary reforms that have helped, I think, change the landscape in California.
It has.
But also Lieutenant Governor Gavin Newsom, who's a friend of mine, has joined my board.
A Democrat, of course.
A Democrat.
Former mayor of San Francisco.
That's right. So we've got a dozen board members who, in fact, exist across the ideological spectrum, but all the members of our board are known for being innovative and people who will drive reform.
Mr. Newsom, I mean, he really is pushing the social media envelope. He had a television show himself as a sitting member in the Lieutenant Governor's office. I mean, he's pushing it. There is no doubt.
Absolutely. And that's the caliber of person we're looking for, notwithstanding a person's party affiliation. Are you a big thinker? Are you willing to embrace change? Are you willing to do things differently?
So we talked about the failings of healthcare.gov.
Yes.
About the challenges of Cover California, which actually hasn't been so bad. It's done pretty well, but Oregon, disaster. I mean, they haven't even launched. So what can you tell us about technology and how you want to marry technology and public policy?
Well, I'll give you an example of one of the projects that we just got funded last month. The Department of Energy has funded a research proposal we put forward, which was to create a national offshore wave energy test facility. A national offshore wave energy
I know you're a
test
geophysicist.
facility.
Is that your title?
That's correct.
Okay.
So here's the challenge.
Okay.
We've seen how solar energy started as a kind of a crazy idea that they put up on satellites. It was a very expensive way to generate electricity. And over the years and decades, and now over this last development cycle, we've seen the cost of solar plummet. In fact,
in a good way.
In a good way.
Right.
It's getting cheaper and cheaper and cheaper. Now it's applied all over. And in fact, the cost of solar has come down to the point where it's very competitive with other technologies. The same thing is true with wind turbines. We're starting to see the same thing with fuel cells. One particular area where we have not seen that advancement yet is in wave energy, which is the ability to convert the motion of the waves offshore into electrical generation.
Got it.
The Obama administration would like to believes that one of the impediments to that technology moving forward is there's no place where those types of equipment can be tested in a real deep water marine environment. So for the most part, when someone has a great idea on how to convert wave motions and energy, it's done through numerical simulation. They run algorithms on their computer. They set up a little wave tank in their lab, or maybe they get out in the bay and try something. But what we need, if we're really going to fast track that type of technology, is a high quality place in deep water, high seas, tough environments, so that folks, commercial developers, can bring different types of wave energy systems.
Where are you going to do this?
The grant that we received is to do a feasibility study, $750,000 of research to look at two locations. One in the Humboldt area, Northern California. The other is off the Santa Barbara coast, more in the Vandenberg area.
The reason I ask is, and again, I'm not a scientist, but I'm sure you remember when there was a desire to do some offshore testing with Diablo Canyon that essentially got shot down because of concerns of its impact on wildlife. I presume that this would not impact that in such a way.
Yeah, this is a very small footprint. It's a floating lab as opposed to a large marine offshore energy generation system, which could be many square miles in extent.
I understand.
And we're actually looking very seriously at looking at trade-off research for that type of work. But the work for which we've been funded first is to look at whether or not California would be the right place for a national test facility. Oregon and Washington are also looking at whether or not they would be the ideal location.
You'll come back?
Absolutely.
His name is Sam Blakeslee. He is now the founding director of the Institute for Advanced Technology and Public Policy at Cal Poly San Luis Obispo. I'm Brad Pomerance. It's Charter California Edition.